Hello, and welcome to our webinar in regards to COBRA versus Wisconsin continuation and what you need to know. My name is Wendy Block, and I am a benefits account manager with Professional Insurance Programs. Today, we are going to talk about federal law versus state law, the eligibility for these laws, the types of coverage, notifications, length of coverage, early terminations, and premiums. So federal versus state law. Both state and federal law give certain individuals who would otherwise lose their group health coverage under an employer or association plan the right to continue their coverage for a period of time. Most employers with 20 or more employees must comply with federal law. Most group health policies providing coverage to Wisconsin residents must comply with state law. So oftentimes you might hear the word mini COBRA or small COBRA or Wisconsin COBRA. Oftentimes that is what we talk about when we're talking about Wisconsin continuation. Wisconsin continuation must be offered to any employee based on the group plan that is 2 or more in size, whereas COBRA is 20 or more in size. Now, if you are on the cusp and you're hovering at 20 and you're not sure if you're federal law or state law, federal law says you base your total employee count on last year's information. So it's always based on the prior year. Federal law under COBRA, it allows most employees, spouses, and their dependents to lose their group coverage under an employer's group health plan to continue at their own expense for a period of time. State law, Wisconsin continuation, applies to group health insurance policies providing hospital or medical coverage. So under COBRA, if you have medical, dental, vision, and flexible spending, if an employee terminates, all of those benefits must be offered under COBRA. However, under Wisconsin continuation, it is health insurance only. Standalone dental, vision, and prescription drug benefits are not required to be provided if offered as separate policies. The law applies to group policies issued to employers of any size. And additionally, employees who live outside of Wisconsin during employment with an employer located in Wisconsin would be eligible for coverage. So when is someone eligible? Under COBRA, an employee must be covered under the group health plan for at least 1 day before the coverage ends. Under Wisconsin continuation, you must be covered under the group health plan for at least 3 consecutive months before being eligible for Wisconsin continuation. So if you have someone who is insured for less than 3 months and they leave, you do not have to offer them Wisconsin continuation. Types of coverage. Again, we talked about that this is any type of health benefit available to active employees and their dependents, whereas under Wisconsin continuation, it is hospital and medical only. Notification requirements. This is important because, again, depending on when someone terminates, this is the amount of time that you have to notify them of their rights. Under COBRA, you have 14 days of that from the time, within 14 days of the person's eligibility, you as the employer must advise the person of their right to continue. Under Wisconsin continuation, it's 5 days. Length of coverage. So terminated employees and their dependents is the most popular reason why someone would be offered COBRA or Wisconsin continuation. But there are also other reasons, like disabled employees, spouses and dependents due to the death of an employee, spouses and dependents due to divorce of an employee, and if a dependent reaches the maximum age under the group health insurance policy. Oh, excuse me. Terminated employees and their dependents get 18 months of coverage under Wisconsin continuation and COBRA. If an employee is disabled, COBRA extends out to 29 months, whereas Wisconsin continuation is only 18 months. If again, eligibility due to the death of the employee, it's 36 months under COBRA, 18 months under Wisconsin continuation. And then for divorce, it is 36 months under COBRA, 18 months under Wisconsin continuation. And lastly, when a dependent reaches maximum age, that maximum age is typically 26. They can be offered COBRA for 36 months, but under Wisconsin continuation, this is not available. Coverage may terminate early if a person fails to pay their premiums. The answer is yes, but you must provide a grace period. If it's the initial payment, there is a 45-day grace period. If it is outside of the initial payment and it is their secondary or additional payments, a 30-day grace period must still be provided. Under Wisconsin continuation, there is no grace period. So if a person fails to pay their monthly premium, you are allowed to terminate their coverage early. If a person establishes residence outside of the state, under COBRA, it does not matter where someone lives. So if a terminated employee moves states, they still need to be offered COBRA accordingly. However, in the state of Wisconsin, if someone is under continuation and moves outside of the state, then their coverage can be terminated early. Person becomes eligible for another group plan. Under COBRA, the answer is no. The person must actually be covered, not just eligible. And then under Wisconsin continuation, if the coverage is similar, then yes, that person can be removed early from the group health plan Wisconsin continuation. Premiums, how much can be charged? Under COBRA, you are allowed to charge 102% of the billed monthly premiums charged by the insurance carrier. The additional 2% is for administrative costs. However, under Wisconsin continuation, you can only charge 100% of the billed monthly premiums charged by the insurance carrier. So that is the end of our session for today. If you have any questions regarding COBRA or state continuation, you need the model notices, or if you have any questions, just give us a call and we'd be happy to help you. Thank you for taking the time. Have a good day.